Hi, my name is Farah Bell, and I'm a student at Nova Southeastern University in the Occupational Therapy Doctorate Program. Today, I'll be demonstrating range of motion and manual muscle testing for hip internal rotation. The muscles being tested today are the tensor fasciae lata, the glute medius, and the glute minimus. All of these are listed on the table, and they all have a common action of hip internal rotation and an innervation of the superior gluteal nerve, as well as the same spinal segment of L4 to S1. I will begin with a range of motion test with the client sitting with their foot in the 90-degree angle and turning the toes outward. I will use the large goniometer and position it as follows. The axis on the midpoint of the patella, the stationary arm perpendicular to the floor, and the movable arm parallel to the anterior tibia.
I'm Farah. I'm an occupational therapy student, doctorate student at Nova Southeastern University. Today we're going to be doing some muscle testing and range of motion. What would you like to be called today?
Illy.
Okay. Hi, Illy. So we're going to go do some muscle testing and range of motion, if that's okay, of your lower leg. So I'm going to be touching and moving around. If you feel any pain at any time, let me know, and I'll go ahead and stop immediately. I also want to let you know that I went ahead and sanitized everything and washed my hands before I came in. Okay. Illy, I'm going to have you sit right here on the edge with your feet hanging off the side. All right, I'm going to go ahead and do range of motion. So I'm going to begin by just placing this towel under your leg. So we're going to do an internal rotation of the hip. Use my large goniometer. I'm going to line up the axis with the midpoint of the patella. The stationary arm will be perpendicular to the floor, and the movable arm will be parallel to the anterior tibia. First, let me see if you can go ahead and move your leg out to the side. Okay, now move it out to the side, please. So she's within normal limits. I'm within 45 degrees. Okay. All right, Illy, we're going to do some muscle strength testing. Put this towel under your leg, under your thigh. All right, now I'm going to confirm against gravity that she's at least a 3. All right, so go ahead and move your leg out to the side. Okay, good, so you're at least a 3. All right, so go ahead and move it back out, and I'm going to try to push you down. Don't let me push you down. 1001, 1002, 1003. So since you had a little bit of muscle weakness and it gave, I would grade you a 4. If you were able to hold for an entire 3 seconds, then it would be a 5. Okay, now I'm going to go ahead and test in a gravity reduced position. So I'm going to have the client lay supine with her leg flexed. So go ahead and lay on your back, closest to the edge that you can. Okay, so I'm going to go ahead and bend your leg. And I'm going to guide you through range of motion. So go ahead and move your leg back out to the side. Okay, good. So I confirm she's at least a 2. So if she wasn't able to do that, I would confirm if she had palpable contractions of her tensor fasciae lata, glute med, and glute minimus. If there was none of that, then it would be a 0 of a grade.
Thank you for being such a great client today, Illy. After you leave, I'm going to go ahead and sanitize the room and wash my hands. Have a good day.